Okay, coming to the rest of the topic, that was our vector, which is important for your practical purpose. Okay. So just a bit, what are the ideal breeding place for Aedes mosquito? Anyone? Don't be conscious. Jore bolo. Artificial container and water type. Water should be stagnant. What I am asking, whether the water would be clean or polluted? Clean, okay. Any identifying features of Aedes mosquito? At least name two. That is sitting posture. And another point? Stripes, alternate black and white stripes. Thus, what the name? What the Aedes mosquito's another name? What is the tiger mosquito? And what disease it transmits? Dengue, all we know, and other chikungunya. And from the last class, in the last class I also mentioned one disease. Multiple fevers we studied. Huh? Nipah virus. Ki suje? Zika. Accumulation of water in artificial containers. This you have to write 16 to 30 degrees centigrade with humidity 60 to 80%. That is the complete answer. Okay. What are the another feature that I expected from you, that Aedes mosquito is day biters. Okay. You might the characteristics of eggs and larva also be asked in the viva. Okay. So remember 2 points of each. That is Culex. Can you name any other diseases that are transmitted by Culex? Huh? Filariasis, Japanese encephalitis. Can you name the specific vector? Culex? Tritaeniorhynchus. And what is the common Culex we see in the nature? Culex fatigans. কি বলার আছে বলো? Okay, the first distinguishing feature of adult Culex mosquito, that when it sits, it shows a characteristics hunchback. I think only Aedes mosquito was covered in the last class, na? Okay. So Culex, it shows a distinguishing hunchback position. Okay. This, it creates a angle more than 90 degree. Now another feature, that wings are unspotted, but it is not easily we can identify the wings, okay, because the wings are generally for mosquitoes are transparent mostly. So we cannot spot we cannot identify the spots easily. So first feature should be the posture. Okay. Another general information, that it makes a buzzing noise. That's why we call them as nuisance mosquito. And the exact vector of lymphatic filariasis, that Culex quinquefasciatus. Okay. And another species is Culex visnoii or Culex tritaeniorhynchus, which is for Japanese encephalitis. Please try to remember the exact spelling because if it is asked in the exam for wrong spelling, marks will be deducted, and that is full marks. 100% marks will be deducted for wrong spelling. Okay. So, another feature we seen in Aedes mosquito. What are the features of mosquito in palpi for male and female mosquito? Who has longer palpi and who has shorter palpi? Females are shorter. Faster. And who has thick sucking tube, male or female? Male. Why male? Male has to take plant juice, okay, that is why. So, for Culex also palpi are shorter than the proboscis in females and palpi longer than proboscis in the males and bent outwards, and it also has pointed tip, this one, okay. This is specific for male Culex. Also these are the areas that we can find the red areas where we find the Culex quinquefasciatus. That means our West Bengal, northeastern and also the Purboghat Parbatmala, what the Eastern Sea, Eastern Ghat, correct, Eastern Ghat, this range, and obviously Sri Lanka, Southeastern Asian Pacific countries also, parts of South America and Australia, okay. And here also red portions are showing the distribution of Culex tritaeniorhynchus or the Visnoi. West Bengal, our West Bengal is habitat of both, okay, and Culex visnoi is commonly seen in North Bengal areas, okay. And also what are the other states? These are the southern states, parts of Tamil Nadu, Karnataka and Andhra Pradesh. That is why JE vaccination is running there, okay. If you have a common question that where JE vaccination is running on, try to remember this map, which Indian states are falling under it, and you can answer, okay. You do not have to remember all the list of all the districts and divisions, just try to remember this picture, okay. That is why I have put it here. What are the features of the habitats and habits? Feeding habit, it is highly anthropophilic and endophagic. What is endophagic and exophagic? It was discussed in the last class. ঘরের মধ্যে খায়, ঘরের বাইরে খায়, এন্ডো মানে ঘরের ভেতরে। What are the timings? Enter the house at dusk and reaches maximum density at midnight. Peak time of biting is also at midnight, since also the MF in your micro you have studied to detect the Wuchereria bancrofti or microfilaria when we have to take the blood sample at the night time, okay. That is why to detect it is very much difficult. We are as a doctor going at the night in patient's house and collecting blood. That is how this program is running also. If we are checking the prevalence of microfilaria infection in previously, public health specialists or epidemiologists are going to the house of the suspected houses of the people in the suspected area at the night to collect the blood, okay. We also heard from them the many stories about what kind of hazards they face, from police, from hooligans, everyone. They are asking, oh, why are you roaming around the area at the midnight? Also, it bites on legs, usually below the knee. And what are the range? About 2 to 3 kilometers. What are the range for Aedes? Remember, 11 kilometers. That is why that was the that is also important in the airport areas, so that we cannot transmit yellow fever or Zika fever from another country, okay, into our country. What are the resting habit? That is endophilic, that means it rests inside the house, usually in the dark corner of the wall, hanging objects, inside shoes, cupboards, under beds. And breeding habit, breeds in brackish water. Brackish water is different from our usual ponds or rivers or other things. Can anyone explain what is brackish? It actually comes from the geographical term, geological term, brackish. হাই সল্ট কন্টেনিং হলে কি আমাদের নালাতে কিউলেক্স মশা হতো? তুমি ইন জেনারেল ভেবে দেখো, এখানে যত নোংরা নালা আছে সবগুলো যদি মশা খোঁজো সব ম্যাক্সিমাম পাবে কিউলেক্স, ম্যাক্সিমাম কেন সবই কিউলেক্স পাবে। আদার কোনো স্পিসিস পেতে পারো, দ্যাট আই ডোন্ট নো, বাট ওখানে বেশিরভাগ কিউলেক্স পাবে। ব্র্যাকিশ মিনস যেখানে where there is no natural flow, the water flows only in the wind. If there is a wind flow, the water will move, otherwise it has no inlet or outlet, just like our drains. If it is blocked, the drains have no way of, our water cannot go to the underground, so the water is stalled there and mosquito can breed, lay eggs there, okay. So brackish or dirty water collection, this term you have to write, okay. Also contaminated with sewage due to inadequate disposal or lack of town planning. Temperature 22 to 38 degrees and humidity 70%. So I expect all from you, if we ask the breeding habit, you mention the temperature and the humidity, okay. Not the other words, only the underlined broad words and temperature and humidity. It completes your answer and gives you extra marks, okay. What are the other spots? Stagnant drains, cesspools, soakage pits, septic tank, open ditches and burrow pits. Look, here they are taking a sample of water. এটা একটা রাস্তায় জমা জল, সেখান থেকে স্যাম্পল নিচ্ছি, ওকে। This is also a septic tank which is open now. Usually septic tanks should be covered, but it is open. So these kinds of water accumulations we usually find Culex mosquito, okay. Now another type of mosquito which is recent times getting popular, that is why it gets a place in your PPT and also in your exam, that is Mansonia. In the first important point you have to remember that it breeds on aquatic plants. Any aquatic plants you know of? হ্যাঁ, আর প্রচুর দেখা যায় কচুরি পানা, কি বললাম আমি শুনতেও পাইনি, ওখান থেকে একটু জোরে বলতে হতো। আর একটা পাওয়া যায় যেটা বলা যাবে না, ঠিক আছে, হ্যাঁ পদ্ম, হোয়াট এভার, অ্যাকোয়াটিক প্ল্যান্টসে রুটসে হচ্ছে গিয়ে ম্যানসেনিয়া উই ক্যান ফাইন্ড, ওকে। It has basal bands on the legs. Look here, the entire leg there is covers of whitish bands, okay. And also two species that are important for you, that is Mansonia uniformis and Mansonia annulifers, okay, annulifers, sorry. It transmits Brugia malai and Timori infection of Filariasis in India. Brugiasis, I think you all have studied in micro. So for Mansonia you only write these points, okay, other points are not that much important. for eggs that usually most commonly asked in MCQ, that star shaped, it lays eggs in star shaped clusters, okay, and it attached to the undersurface of these aquatic plants. Star shaped clusters that you have to remember. These are not important. Habits you all know, but the flight range is 1700 meters, not much. This only. What is the mosquito? Is it matching Aedes? Is it matching Culex? Huh? Is it matching or not? Matching, na? Hunch, more than 90 degree. Is it matching or not? Please not try to focus on the words that it should be more than 90 degree, that means hunchback, not only on the picture. Picture will be changed in your exam. Models will be changed. Focus on the words, distinguishing features. Okay. What is the mosquito, this head part? Which kind of mosquito? Is there a pointed tip? If it is a pointed tip, what is that? Female Aedes. Do I have to again repeat the Aedes part or not? Or you all are waiting for the PPT only? Okay, your choice. This one? Again, same picture, only different species. Sorry. Now we are coming to the most important mosquito of all, that is Anopheles, and all we know that Anopheles is responsible for malaria. How many types of malaria we see? 4 or 5? 5. What are the names? Benign, tertian, quartan. What causes Plasmodium falciparum causes? Malignant malaria. Benign malaria causes by Vivax. Quartan, and what is left? No. And what Cabot's ring seen in? Murphy dots. সব কি ছোড়া হচ্ছে? একটু আরেকবার মাইক্রোতে প্লিজ রিভাইজ করে নিও ম্যালেরিয়ার এই পার্টটা, তাহলে then you coming to the disease, you all know the treatment, mainstay of treatment you all know, that is chloroquine and primaquine. Primaquine is for why, what are the reason? Relapse. For relapse there is also one term, that is recrudescence. If it's a pregnant female, what we give? Chloroquine or quinine. Konta debo? Quinine. And if it's a malignant malaria, ACT, artemisinin combination therapy. And if there is ACT resistance, read na. So now Anopheles mosquito. So what is this angle with the surface? আমি বাংলায় সূক্ষ্মকোণ বলতাম, আমি ইংরেজি জানি না, 10 অব দি বেঙ্গলি মিডিয়াম। অ্যাকিউট, তাই তো, তার অবটিউজ মানে মোর দ্যান 90, তাই তো, ওকে, দেন ইট ইজ অ্যাকিউট অ্যাঙ্গেল. What it causes? Malaria, it has spotted wings, that is why wings are important, but first feature is always the sitting posture. It creates an acute angle with the surface, or usually we tell it angle of 45. It has no buzzing sound and angle 45, spotted wings, only these 2 points, okay. You have to write these 2 distinguishing points, and it is Anopheles. Now coming to the head part, what is the difference here? Palpis are as long as proboscis for only Anopheles mosquito. For Aedes or Culex, there are difference in the lengths of palpi and proboscis, okay. This is another picture of Anopheles mosquito, and also the males have bulbs at the tip of their palpis. Female do not have bulbs. This is to differentiate between Anopheles male and Anopheles female, okay. These are the some species names. Anopheles culefacis, it is widely distributed in rural and peri-urban area. Anopheles stephensii, the most common known name, it is usually a vector of urban area in coastal region, and it also prefers the human dwelling and cattle shed. A MCQ once came that in cattle shed what kind of mosquitoes are found, okay. We all answered Culex, because we thought that in a cattle shed there would be a accumulation of water, it cannot getting out, but the actual answer was Anopheles stephensii, okay. That is why this is important, and other names you do not have to remember that much, but if you can, then remember flu vitalis is for forest area, it also causes the forest malaria, and minimus is foothills of northeastern states, Dirus in also northeastern region, and Sundaikas, okay. It actually first identified in Sundarban but distributed in Andaman and Nicobar area, okay. This is also a picture. If you can remember the picture, it is also too easier for you to identify the species, okay. So this is a table of differences between various types of parasites that causes malaria, okay. Falciparum is tropical, Vivax is Tertian, Malary is Quartan, Ovel also Tertian, but it is endemic in Africa. You have to remember the Falciparum, Vivax and Malary, and the involvement in that area and the severity of the disease, okay. This is also now getting very common, that is Malaria knowlesi, okay. Usually previously it was mistaken as Quartan malaria, but now it has a separate name, separate features, and it is usually seen in Malaysia, Thailand, these areas, okay. You can remember this, this is getting very popular in the world scenario, okay, this malaria. Now coming to the habitats, we all know what are the physical features, we know what are the difference between male and female Anopheles, and now coming to the feeding habits, it is anthropophilic and also zoophilic. So it cannot distinguish between human or other animal, true kind of bloodsuckers. Biting time, it is throughout the evening and early part of the night. This is a night biter, not a day biter. And what are the resting habits? This is a indoor resting habit in human dwellings and cattle sheds, okay. It is endophilic type. Breeding place, prefer clean water, okay. Only if there is clean water, Anopheles mosquito lay eggs, okay. It did not differentiate where is the site. It can be in artificial containers or artificial spaces, or in the river beds, or even in brackish waters. It does not distinguish. Culex prefers brackish, Aedes prefers clean water of stored in the artificial container, but Anopheles mosquito did not have any preference. They have only the aim to lay the eggs and to take the blood from every kind of animals. Okay. What are the range? 1 to 3 kilometers. This is a high impact states of malaria. What is this state? This is West Bengal, here Jharkhand, Bihar, Madhya Pradesh. Part of Odisha is not here. Okay. This you all know what are the annual parasite index. I think it is covered in the NPVDCP. For mosquitoes and malaria, dengue, these things, you have to remember the indexes. Okay. It might be asked because these are the evaluation indicators, how much well the program is running. It might ask, okay, what are the definition of annual parasite index, what are the importance of annual blood examination rate, this, and what are the significance. It is written in your park book. Okay, please read those lines. What is performance indicator? Which is performance indicator? Which is used to evaluate the program? Which indicator? It is might ask. Okay. Please cover these things. For Anopheles eggs, these eggs are usually lay single, okay, not star shaped cluster like Mansonia, and it is also boat shaped and it has lateral floats, okay, if it is in the flowing water, lateral float, not up down or this lateral. For larva, you have to remember this is a specific feature. Usually for Aedes, larva is siphon upore, matha niche. For Culex also some similar type, but Anopheles usually just under the water. It might seems the tentacles are attached to the water level. Okay, the water they are stuck to the water level. I probably had one picture of usual, okay, but I lost it. If I can find, I will share it with you. Usually if it is the water level, the larva will lay like that. Okay, it floats. How to write it? It floats horizontally just below the surface of water, and it is very active with swift movement. It might move like this pointer. Okay, this. We usually do that entomological survey. We did in airport, Damdam Airport, Kolkata. We find 3 or 4 spots of Anopheles mosquito. Usually what we use a ladle. Ladle, you can understand. Saucepan, omelette করার saucepan যা হয় সেটাই আমি এমনি করে জলগুলো তুলে তুলে দেখি জায়গা থেকে। তো ওয়ান স্পেস এরকম তুলে অনেকটা জলই তুলতে হয় যাতে মশাগুলো ভালোভাবে মুভমেন্টগুলো বোঝা যায়, কোনো মশা যদি নিচে ডিপ করছে সেটাও বোঝা যাবে সাইড। So it moves like this zigzag, no specific direction. Usually it tries to avoid the sunlight. Okay. Now, what is which mosquito head is this? বাল্ব আছে কি হলো এখনো মিস যাচ্ছে লোকজনে? This is not acceptable. It is your MCQ. It might come as MCQ, sir. That is why. This one, কিছু প্রবলেম থাকলে বলো, এতজনের ভুল হলে তো মানা যাবে না। Am I right? Is it female Anopheles? কেন? বাল্ব নেই আর সাইজগুলো সমান। that you know, okay. Aedes transmit dengue, yellow fever, chikungunya, Zika, Rift Valley fever and also filaria, but not in India. For India, we have specific vector. You do know the integrated vector management. We have some anti-larval measures, anti-adult measures and measures for egg. Usually for egg, we use biological control or pesticides. Biological control, what do we use? Gambusia or Guppy, Guppy fish, okay. And for anti-larval, they are also biological, same. যে ডিম খাবে সে ওটাও খেয়ে নেবে, ঠিক আছে। গাপ্পি মাছও ধরুন, it seems like some small piranha, okay. If you put your finger, it might cut your finger off. And they also move in a school. A group of fish is called a school of fish, moves in a school, okay. And what are the chemical for anti-larval? What are the chemicals? Huh? Paraffin or parathion, malathion, acha. You can use also kerosene oils. What are the reason? To kill them by asphyxiation. And anti-adult, we have multiple measures, IRS, fuming, everything, okay. Just try to read the picture and also read from NVVDCP, National Vector-Borne Disease Control Program. Integrated vector management is a very important question, okay. Very, very important. There are other two vectors you have to learn. One I will tell, other is not that much important, okay. That is Sandfly. This is usually we do not see in now. Usually previously in any home, if it is what you say kacha or pakka, if it has broken crevices in the wall, we usually find Sandflies, okay. And we all know Sandflies carries causes or carries or is vector for Kala-Azar, okay. What is the scientific name? Now for Sandfly, Phlebotomus argentipes, argenta for, yes, that is for, what is the chemical name of silver? British thought that this country probably has very rich in silver, that is why they named that Argentina, but very sadly no silver there, okay. But a name is a name. Columbus also named America India. West Indies, the name came from there, okay. So Sandfly, Phlebotomus argentipes, it what transmitted Leishmaniasis, oriental sore, Oroya fever and Sandfly fever. Not only causes Leishmaniasis, it can cause his own disease, its own disease, that is Sandfly fever, okay. As you can see, it is almost look like a mosquito, but very small in size, okay. That is the only thing you can say on it. It looks nothing like these three types of mosquitoes and it is a very small in size. Then it is Sandfly, okay. Obviously, it has some distinguished feature that it is a long hairy antenna, palpi and proboscis, so much longer than its own body, okay. That is one distinguishing feature. Also, abdomen in the female, the tip is rounded and in the male there is claspers. Usually this is, you can remember, try to remember, but in real life the only thing you can try to identify Sandfly are their size and the very long antenna and proboscis, okay. What are the resting and breeding sites? Animal burrow, banana bush, beetle bush, cattle hut, but In your public health experience, what examiner will ask you? If there is crevices in the wall, and also in your family visit, if you have seen the crevices in the wall, in your family schedule there was one question, na? Is there any crevice or something in the wall? Is there a question? In environment part? Okay. It might ask, they might ask what are the reason of it, and that is it might be a place of presence of sandfly. Okay. So, cattle shed too important for two types. One is which mosquito? Anopheles, and second is sandfly. Ticks are not important, okay, but my advice, at least try to remember the disease caused by different type of ticks, okay.